Our next task is food poisoning, campylobacteriosis. In this particular case, an FY2 in a GP surgery, a 42-year-old woman has made an appointment to see you. She is here for a follow-up, and it is a telephone consultation. It may as well be a face-to-face. This particular patient had come 2 weeks ago with diarrhea. At the time, she was passing stools 7 to 8 times a day. But the diarrhea has now come down. She's passing stools 3 to 4 times a day. There was blood in the stools. She had abdominal pain and the bloody diarrhea. She remembered eating food from the fridge, which she had kept for a long period of time, over a month. On that particular day, she was hungry. She came from work. She had no time to go and buy food. So she decided just to eat whatever is in the fridge. And following eating that food, she started experiencing diarrhea and abdominal pain. She had come to a GP surgery 2 weeks ago, and you took some stool sample, and the stool sample has been done, okay, which shows the result of campylobacteriosis. And your task is to talk to the patient. Patient has got some questions. What are you going to do for me, doctor? Do I need any treatment? Approach to the task, as discussed before in the general approach to gastroenteritis. You're going to ask about the symptoms of diarrhea. You're going to rule out dehydration. You're going to ask about the differential diagnosis of different causes of what? Of diarrhea. So just going to write here for you. Okay, the differential diagnosis of what? Of diarrhea. Do the raw dehydration, the P-maltosa, the effects of symptoms. She has had this for the last 2 weeks. Then you perform examinations. Okay, observations, abdominal examination. You may want to do a perectal examination. But in this particular case, because this is a telephone consultation, you don't need any examination. In a face-to-face, you would want to perform observations, abdominal examination, and perectal examination. But it's a follow-up, it's a telephone call. So your task would only be to discuss the results. So you're going to take the history and explain. You're going to first of all say, I do have the results of your stool sample. Okay. And I want to ask you some questions in terms of the symptoms you had before you, of course, you had these investigations. Then you're going to take that history we have discussed here. After you've taken this history, then you're going to explain the results. That you have the stool sample, which shows that the cause of your diarrhea is an infection called the Campylobacter. Okay, and you can see that erythrocyte positive because it is blood, leukocyte positive in the stool sample because an infection. So there is an infection, and there is blood, and that is the cause of the Campylobacter. Then next patient has got what we call campylobacteriosis. Yeah, it's a bacteria infection. Gastroenteritis caused by bacteria infection. You're going to give her advice to continue taking fluid, offer a leaflet about this food poisoning, and explain that the most likely cause is a food which she ate, which was kept in the fridge for a long period of time. Now, ask if there's anyone else at home and explain that this infection can spread to other people. So she advised to clean the toilet seats and toilet flushing handles frequently, not to be preparing food for others, wash hands after use of the toilets, generally wash hands frequently. Okay. So in this particular case, the antibiotics are not needed because she's now passing diarrhea 3 to 4 times. It's not a high output diarrhea. She's not immunocompromised, but you're going to have to explain that we have to report this to what? To a health protection unit. You report them to the health protection team. It is a notifiable condition. Okay. Now, because the food was left that for a long period of time. Okay, food was left for a long period of time, was in the fridge. Of course, we have to report that. It could be an isolated incident in this particular case, but you still have to report because we found what? There is Campylobacter, and the guidelines suggest to report. Okay, so to summarize our management, we're going to have to explain that the patient has got an infection. Okay, the gastroenteritis caused by what? Campylobacter. It's likely to be caused by the food. It's the food poisoning because caused by the food she ate, which was left in the fridge for a long period of time. Okay, we're also going to explain that you're going to have to report anyway to the infection, to the health protection team, because it is a food poisoning. You're going to give her advice of personal hygiene, offer a leaflet, and explain that if things should be improving now, she doesn't need any specific treatment. Okay, advise oral intake, and the diarrhea should settle down. But if it worsens, then safety netting is to come back. Thank you.